Can latent TB spread to other people? Imagine carrying a silent passenger inside you that's not causing any trouble. That's what happens with latent tuberculosis infection. People with latent TB have the bacteria Mycobacterium tuberculosis in their bodies, but it's in a dormant or inactive state. They feel perfectly healthy, show no symptoms, and cannot spread the bacteria to others. The immune system keeps the bacteria in check, preventing it from multiplying or escaping into the air. Because of this, latent TB is not contagious. Only when someone develops active tuberculosis disease do they become contagious. Active TB usually affects the lungs or voice box and causes symptoms like a persistent cough, chest pain, or coughing up blood. When this happens, the bacteria are active and can be released into the air through coughing, sneezing, speaking, or singing. People nearby can then inhale these bacteria and become infected. It's important to understand that latent TB cannot spread from person to person during this inactive phase. The bacteria are contained within the body and are not shed into the environment. This means that if you have latent TB, you are not a risk to others. However, if the immune system weakens over time, latent TB can sometimes turn into active TB. That's why doctors often recommend treatment for latent TB to prevent this progression. Treating latent TB usually involves taking antibiotics for several months, which kills the bacteria before they can cause active disease. This not only protects the individual but also helps prevent future transmission. Regular testing and medical follow-up are essential, especially for those at higher risk of immune suppression or exposure. In summary, latent tuberculosis infection does not spread to other people. It's only when TB becomes active and affects the lungs or voice box that it can be contagious. Always consult healthcare professionals for proper diagnosis and treatment options. Understanding this difference helps reduce stigma and promotes effective prevention strategies.